Good morning to you. It's Daybreak at iFiber One News Radio. I'm Jeff Slakey on a Friday, 7:41. Got a great guest in studio to talk a little bit about the recent news around the Northwest of increased bats that we're finding in homes and interacting with people from Mason County Public Health. Debbie Riley on the air. Good morning.
Good morning, Jeff.
So nice to see you.
You too.
Happy Friday, and we were talking about this story all week long in the news, hearing reports of bats, most in King County near Green Lake, but some moving in Pierce County, I should say. And so we said, I bet Debbie's got the information on what's going on here, so bring you on. What is going on? Is this kind of a annual thing as summer comes to a close and people are maybe just a little more aware of their surroundings, or are we seeing more bats?
Well, part of it is the heat we're experiencing. Bats, like some of the rest of us, don't do heat well. Mm-hmm. And in nature, only about 1 to 3% of bats are rabid.
Oh.
But because of the heat, because they're doing things that aren't natural, they're out in the daytime if they're sick, they're on concrete, and you know how hot it gets at street level. Mm-hmm. There are places where people are seeing them. Yesterday, I read the news release that King County is now up to 5 rabid bats.
Yeah. And
last year they had 3 total. So we're not that far ahead. We are ahead. And there is also a migration that takes place in the fall.
Oh, okay.
And we have bats flying through that don't really know where to
they're
stay.
going. Sure.
They know where they're going. They just have trouble getting there sometimes. In the spring, sometimes I come and talk to you about bats, and that's when we have the babies. And they're learning how to fly, and they'll fall out of trees, and they're on the ground, and so a pet gets them or a child finds one. And all they're trying to do is get back up to some sort of height so they can soar and take off again. In the fall, we're starting to see the sick ones that are where they're not supposed to be.
Okay.
And what we do is ask people, do not handle them with your hands. Please teach your children not to touch any wild animal, and keep your pets vaccinated so they don't contract rabies by catching a sick bat. Because of all of the news media and the coverage, we have people properly collecting their bats. We have that information on our website at Mason County. Bringing it right straight to the front counter. And we ask that you please don't do that call first.
Yeah.
Yeah, we have a very small reception area. We have moms with new babies and little kids and burly contractors and everybody else all mixed together in that very small space. And when a citizen comes in with a bat in a bag, they get excited. So
I would
call
think
us.
So.
Let us know if you're bringing it in, if you don't know what else to do and can't get a hold of us by phone. Leave it in the car. Come in and talk to us, and we'll go out to the car with you.
Does Mason County have higher bat populations than other counties because of just the geographic makeup of the county, and because there's not as many? Well, I mean, with Shelton being the only incorporated city and, about a 900,000 person population in Belfair, there's not a lot of major hubs of populace. Does that increase the amount of confidence a bat would have maybe flying around the public?
That's an excellent question. I really don't know. But I know that bats do a remarkable service for us here in Mason County.
So tell us about that.
Oh, they eat bugs. We would just be overrun with things like mosquitoes and the other bugs that bother us. I don't know about you, but when I drive home at night and the bugs are gathering in the headlights,
yeah,
every now and then you see a bat swoop through and grab one. It's really cool to see. Without them, we would have a lot more of the mosquito-carried diseases, and we wouldn't be able to enjoy our outdoors as much as we can right now.
Interesting.
Yeah, our bats are very, very interesting. There's bat diseases that we've been reading about recently, and I know the folks at Fish and Wildlife are really keeping an eye on the white nose syndrome, I believe it is called, to try and protect our bats here in this area. But we have some wonderful camps and outdoor recreation facilities. One year I got a call from a mom who was concerned because they were at one of the outdoor camps in the area, and a bat swooped at her and the children she was escorting back to their cabin at night. And I said, by any chance, were you holding a flashlight? And she went, oh. So, because the light attracted the flies and the mosquitoes and stuff, and the bat swooped
and that's
in.
what swooped in there.
Sure, you rang the dinner bell.
Interesting. So that is a good tip to be aware of. What do we commonly hear when we know there are bats around? Is it the squeaking? Is there a squeaking, or do you hear a bunch of flapping, or how do we know that we're in a bat zone?
If they're flying, you hear the flapping. I don't know that most people would notice the squeaking. We do encourage anyone who has been sleeping in a room and finds a bat in the room to bring it in for testing.
Okay.
Because bat teeth are so small, and if they did bite you, you wouldn't really know it. You wouldn't see a bite like you would with a larger animal, like, say, a cat or a dog.
Okay.
So anybody that's been sleeping with a bat in the room, very young children who can't tell you what's been going on, or elderly or infirmed who might not notice, those are real concerns.
Are there some early signs that are helpful for prevention if somebody gets bitten by a bat, but they're not sure, they don't know they were bitten, and if there happens to be rabies or anything like that? Is there a quick, not a quick way, but is there something that starts off first things first? You start to get a headache or stiffness or soreness?
By the time you start having those symptoms, it's too late.
Oh my gosh.
They say that rabies is 100% fatal. We have heard in the last few years of a person here or there that has survived rabies, but you want to err on the side of caution.
Yeah.
It's not the 20 shots to the stomach that we all heard horror stories about growing up. I believe, and see, I'm going to say this wrong, but it's 6 or under shots.
Okay.
And they start with what they call an immune globulin, which kicks your system into gear for accepting the other shots. So err on the side of caution. You do not wait for symptoms. It's too late at that point in time.
And that's right to the emergency room.
Your family physician, the emergency room, report it to the health department, and our health officer, Dr. Yu, helps people through the steps. But your personal physician is the best place to start.
Wow. Yeah. Okay. Well, we will continue to see the bats as we move into the fall, and then once again in the spring when the babies are out. So just be advised and steer clear if you have to, if you can, and if you think you see them in your house, don't touch them. What type of gloves? Latex gloves, or something stronger like garden gloves?
Something stronger like garden gloves. Set of tongs. Anything so you don't have to touch them.
Okay. And
then we suggest that you double bag them.
Okay.
But yeah, you hit the nail on the head. Don't touch a bat. Keep your children away from bats and other wild animals, and keep your pets vaccinated.
Wow, very good. Debbie Riley from Mason County Public Health in with a little bit of friendly advice here as we move into the Labor Day holiday. Nice to see you, Deb.
Nice to see you too,
Have a
Jeff.
good long weekend.
Thank you.